All right, we're live again. I'm here with Dave from NYC Pain Md, and we're going to talk about one of the most important things. NYC Pain Md treats pain, a lot of knee pain, but they also treat shoulder, hip, knee, neck, back. But one of the things we're going to talk about today is NYC Pain Md uses the best possible, most advanced treatments for pain available. And when people hear this, they often think that this must cost a lot of money. And a lot of times they go to a hospital or they go to a clinic and they're quoted, a huge amount, a huge bill, and they can't afford care. So we're here today to talk about how NYC Pain MD can offer the most advanced treatments that are out there today, but they can offer them at a fraction of the cost. So Dave is here, and he's going to explain this. Dave?
Hey, Brad. Good afternoon. Thanks for doing the webinar with us again here. It's always a good idea to communicate with patients, and I think it's been very fruitful. We get a lot of inquiries from our webinars, and we've been helping a lot of people because of it. One of the things he sort of wanted to not just gloss over, but get very, very clear on, that, it's always in the news, the cost of healthcare, the cost of procedures, the cost of hospitalization. And so while sometimes it seems like every doctor, it almost feels like, and I know it's not necessarily true, but almost feels like they just try to find the most expensive covered procedure and just kind of, bang away and offer that and so forth. But that's what causes insurances to go up. That's what causes your co-insurances to go up, because patients do share a percentage of the cost. And of course, then your premiums go up because the care is so expensive and the insurers have to pay for it. So aside from our sort of use of the highest technology and promoting the most revolutionary procedures, one of the things is that we have to deal with is reality. And a lot of patients don't have the insurance coverage, have higher co-payments, huge deductibles. Some patients are not insured at all. And so one of the things that we've evolved, and I think we're evolutionary in that, is a way to cut out a lot of the middleman, so to speak, a lot of the excess that is completely unnecessary. Sometimes it is, but we try to cut out all the fat and give you the basics, but we can do everything right in a kind of a one-stop facility. And we can get into how that saves the patient and, of course, your insurance company as well a lot of money. If we can save insurers money, guess what? They're going to hopefully lower your monthly costs. And I think it's very prominent in news. I know even the president's talking about the cost of healthcare all the time and the issues with Medicare and so forth. So I think that would be the gist of our conversation today.
That's really important because the whole healthcare thing is huge now. So let's jump right into the crux of this here. How can NYC Pain MD offer the most advanced treatments for pain and not charge the huge prices patients often see elsewhere?
Right. I think the elephant in the room, if we could call it that, is this issue of what are called facility fees. So if you end up doing a procedure for your knee or your back, and we're not talking surgery, some patients should be in a hospital or a major surgery center for a procedure, but there are so many of these procedures that in our mind, you do not need to be in a hospital. You do not need to have surgical center. What the hospitals do, what the surgery centers do, is they actually bill something called a facility fee. The facility fee is the cost of the room, the use of the technology, all sorts of issues that go on. So basically, that hospital or a surgical center will charge a facility fee that is often as much or more expensive than the procedure and the medicines and technology needed to provide the procedure. It could literally double your cost or even more. We have patients come in and show us explanation of benefits or insurance receipts and some of the charges that the hospitals are levying to patients and insurance companies, and it is staggering. So the evolution that we're sort of trying to bring on at NYC Pain MD is to skip over that. Certainly there are patients with comorbidities or complex medical reasons that it would be very important to be in a surgery center or a hospital, and they may have bleeding issues, cardiac issues, but the vast majority of patients and the vast majority of procedures that we do absolutely do not need these extra facilities. They cost staggering amounts of money. In that the patient is sharing these facility fees that could be several $1,000s or even more for a procedure. This is really, really serious dollars. And so what we do is not only do we offer a no-cost evaluation to see if we can even help you, there are no facility fees at NYC Pain MD. All that we have is a procedure fee and the cost of the medicines involved, the procedure being doctor's fees and time and so forth, which includes the use of the technology. There's nothing extra. There's no hidden gems. There's no hidden cost. There's nothing under the covers that somebody's trying to sneak in, which sometimes I feel is done at these outside facilities. And patients are often blown away when they get the bill from the hospital. And so this cannot be understated. And it's cost the system so much money that was unnecessary, at least in the opinion of our facility.
Yeah, I have a question there because what instantly comes to mind to me is, I've heard about these backroom doctors and stuff that they're doing procedures where they shouldn't be. This isn't what you're talking about, right?
No. Our doctors are certified in interventional pain treatments, and their specialty is interventional pain treatment of joints using non-surgical methods to keep you out of surgery. Of course, that's another issue with costs. That was my next thought, is that, and we've talked about some of the research done where, particularly for knees, 75% of the patients have been able to avoid knee surgery, which costs literally 20, 30, 40 times more the cost of some of our procedures. So not only are we trying to give you the most efficient use cost-wise of the facilities, we're getting these great outcomes where patients are avoiding complex and super expensive procedures that do require major hospitalizations and major surgery fees and so forth. And if you can cut that out, cut that huge amount of fat in the system, you're talking about, gargantuan savings that just can't be ignored anymore. And from a patient standpoint, I think they don't even know this is going on. Of course, that's why I thought it would be good to talk about today, that we've just got to make patients aware of these costs and ongoing scenarios that are happening in the healthcare world.
Yeah, and there's the issue too that when I'm on the internet, I see a lot of stuff where people want to know a few things. They want to know results and they want to know cost. And we're talking about costs now. But could you briefly talk about results? And I know there's some research out now. Does this work for everyone?
Right. That's a great question. We have talked about this time to time, but of course, regardless if a treatment is free but it doesn't work, then it's worthless. If the treatment is $1, it's worthless if it doesn't help. But the data, if we talk just about the arthritis knee treatments, where we do precision arthritis targeting with imaging, where we very precisely apply these FDA-approved medicines and other advanced procedures like stem cells, platelet treatments, A2M, protein treatments, a new thing called Zilretta, nerve blocks, radio frequency. These work well in the majority of cases. But to be very clear, Brad, the majority is not 100%. There's no medical procedure on the planet that works the way we would like it on 100% of the patients. What I can tell you for sure that the majority of patients that enter into our office, they're pretty happy they came in to treat. But there are some patients that don't respond. They need to be referred out to other facilities. Some patients that the doctors felt it was worth trying different procedures to try to avoid surgeries or being on opioid type drugs. Maybe we don't get the results we want. But I would say 4 out of 5 patients do substantially better. They're very happy with the care. And if they stay on top of their health, they'll continue to do well and not have to get involved in those other complex things we just mentioned.
I've heard some people say that they went somewhere and the treatment didn't work for them. Therefore, the treatment doesn't work. 2 things there. Where did this person go? And the treatment, just because it didn't work for them, doesn't mean it doesn't work, correct?
Yeah, I couldn't agree with you more. It's like You know, if you have a bad actor in the lead role, the movie could be terrible. But if you get a great actor, of course, they turn it into, an Academy Award winner. So first of all, the doctors that are doing a procedure have to be very skilled in it. In our office, that's obviously paramount. And they have to have the technology. I hear from the medical department every week, 15, 20, 30, 40, even 50% of the patients come in and they had procedures to a hip, to a knee, to a shoulder, and the doctor just did the procedure blind. Now, I'm not a medical professional. I'm more of a patient advocate and education specialist, but a joint that's arthritic or damaged is very narrow. It's trying to like thread a needle in the dark. So if the doctor goes into that joint blind, there's a good chance the medicine they're using never gets there. Now, I'm not making any judgment on any doctor or telling them how to practice. That would be inappropriate of me. But I will tell you that the research indicates that there's a rather disturbingly high inaccuracy rate without the right technology. And so if you've had treatments where they've done it blind, without imaging, without guidance, without what they call pre-treatment arthroscopy, to be very precise, it could very well be the reason you did not respond. Also in our office, we have all these other options. We don't just use one type of lubricating medicine or treatment regimen. We have basically all of those available, and it's got to be best suited for a patient. Sometimes one medicine won't work, but we'll try another one, and that'll hit a home run. A good analogy might be some patients, their headaches go away with Advil, and others it doesn't help at all. They have to take a leave, just the way the body responds. But you have to have these resources available to give patients the ultimate and best chance of healing up. So that was an excellent question, and I'm glad you brought up that point.
Yeah, and you guys have a lot of different stuff under one roof. So a patient can come to you, and a lot of times when they go elsewhere, they have to go to a specialist, and then they get referred out, and they get referred out. But NYC Pain MD has been set up so that it has a lot under one roof, correct?
Yeah, absolutely. And we treat, spines and necks and backs, lots of knees and hips. And, I've heard some other facilities where they don't even have an x-ray facility. So someone that's hobbling around on a bad hip or can barely walk because of their back, they have to be referred to another clinic in some other distant part of a city just to get an x-ray. So, we want to try to get the diagnostics in and try to get the patient moving in the right direction as soon as possible with the least amount of stress and friction that would stop them from getting the best care in the most convenient fashion. So, no, that's very important. And to have all these other treatments, whether it be regenerative care with platelets and stem cells or like ATM proteins and so forth, this newest anti-inflammatory treatment called Zilretta that we can talk about at another time. So, yes, no, you have to have the variety because there's not just one treatment that works for everybody. You've got to be able to diagnose the patient and create a personalized, customized treatment plan for that patient.
And you guys have payment plans so that most people can afford the care, correct?
Absolutely. We created a really special program with the group called Care Credit. So not only do we help reduce the total fee by cutting out the so-called middleman with all those excessive facility fees that in a lot of cases aren't necessary, like we said, but Care Credit will let patients spread out payments over 18 months, interest-free. If you need longer, some patients pay as little as $10, $12, $14 a week towards a care program to get them healthier and keep them out of surgery and get them moving again.
It's a huge thing because cost is just, you can, like you said, you could be $1, and if it doesn't work, so what? But then again, if it does work, but the patient can't afford the care, that's really bad too. So you guys have set this up in a way specifically when NYC Pain MD was being built and grown so that you could help as many as you possibly could, correct?
Correct. And Brett, absolutely. Listen, really good care. There is some expense to it. You can't get good care for, bargain prices. I would be careful with that too. But it doesn't have to be excessive. And remember, we're not only treating a patient, we're treating a person. That person not only has pain, is not only impairing their life, their ability to work and move and function and enjoy themselves and their families, but they have a financial history. And we're far from insensitive to that. We understand these issues. Everybody's got a pie to draw from financially, and they can't be, deluged with cost and non-affordability. So we try to be cognizant of that because we're treating a person and their family and their whole life has to be thought about when it comes to these issues.
If someone's watching this right now and interested, what's their next move?
So they could call. I think you're going to put up a number on the screen, but they can call the office. We do offer a great program. We offer a no-cost initial evaluation program. You'll come in. A staff member will ask lots of questions, the history of your condition. Based on that, they'll chat with a physician and they'll probably get a pre-evaluation x-ray. And then the doctor will examine that area in pain. They'll go over your case in detail. Now, sometimes we can't help patients, they'll be referred out. But if the doc can, he'll create a personalized, customized treatment plan based on what they believe is to be the best course of care. And of course, at that point, you have all these options to talk about insurance and finance. And, you come in for the evaluation, there's no obligation. You can proceed exactly as you'd like from there. And so the one thing that we want to do on these no cost, these complimentary evals is we want to make sure that we get you at least a plan of action. How you proceed from that is, or from that point is up to you. But we want a plan. We want the patient getting some direction. And whether it be at another facility or something we can't handle or with us, we want to make sure that they have direction and that they're going to feel a lot better and a sigh of relief once they know there is a possible answer to their problem.
Yeah, the biggest thing for me, I know, is when I just don't know. I remember I had a toothache years ago and I didn't know, you know what I mean? And I went in the dentist and it was worse before I sat down and he took a look and he said, hey, here's what you have. Here's what we have to do. And in the end, it wasn't as bad as I thought.
Right.
The biggest problem was when I just didn't know.
Yeah, no doubt. We have patients that come in, and I hear from the medical staff that patients have been to 3 or 4 or 5 places or facilities or physicians, and they'll look at our staff and say, now I understand what I'm dealing with. I didn't even understand it before. No one told me I had all these options or how it might work. Or, sometimes as simple as, having told the patient to make sure that they ice the knee several times a day after treatment, or how to wear a brace properly. So some simple things make the hugest difference. And so that has to do with thoroughness of care and understanding that it's, there's case management is very important. And case management is not only procedures, but guidance in and out of the office as well. So you hit the nail on the head on that one. And there's a lot of truth to those patients not getting direction. And, hopefully that's where we fit the bill and help people and make a difference. That's the evolution of it.
Yeah. So in a nutshell here, NYC Pain MD offers the most advanced treatments for pain available, and they do it at a cost most people can afford. And if they'd like a complimentary screening to get their questions answered and find out if they can be helped, the number's up on the screen right now. Give them a call, and they should ask for who?
They can ask for Alex. Alex is another representative that can answer all sorts of questions. He's very well trained. There's other staff members. Milagros is an office manager. All they have to do is say they heard a webinar, they heard about the facility, have some questions on whatever it is that's bothering them, and normally they're going to get good directions. And if it's appropriate, they'll be invited in for the no-cost screening. And then they'll get to see a physician and really get some plan and direction in regard to their condition.
One last thing, too.
Yeah.
Do you guys have Spanish-speaking help there?
Yes, we do. The vast majority of staff is bilingual. Quite a few, a large percentage of the population in New York City is more comfortable speaking Spanish, so we're very well equipped. The doctors can communicate in Spanish, so the Spanish-speaking population is very comfortable in our office.